So, last year, towards the end of the year, we did an article that was looking at business continuity planning in the ecosystem within the industry, that is the pharmaceutical industry in Kenya and across Africa. When that article came out, we looked at some of the regulatory changes, the regulatory requests and demands of regulatory authorities, and in doing so, then we made it clear that whenever we're getting into the new year 2026, pharmaceutical companies, whether from a manufacturer, distributor, or a logistics firm, or whatever kind of scope you practice is, you needed to ensure that you retain your license and renew that license, and in doing so, then continue to do business in the coming year. There were new requirements that were coming in. There were existing requirements that were already there but were not being enforced, and the subsequent piece is ensuring that you're meeting these compliance requirements. The key thing that has happened from a Kenyan context is the Pharmacy and Poisons Board has actually made a commitment to ensure that enforcement of these regulatory requirements is at top notch, and actually they are going to ensure every single distributor or premise that is operating in the market has been audited and has actually complied with those requirements that are provided in the market. Which is a good move when you look at it in terms of safeguarding our health product supply chain and distribution practices, because then if we do not enforce these requirements, there's a risk in the system that there might be substandard, falsified, or even poor quality medicines at the least, and these are going to cause an impact in terms of quality of healthcare outcomes in the country. The role of the regulatory system and the healthcare sector is to safeguard public health interest, guaranteeing that that patient who is going to that level 1, level 2, level 3 primary healthcare facility, when they take a medicine, that medicine will do what it is supposed to do, will relieve them of their pain, will cure their condition, and will give them relief to be able to lead healthy, productive life. That is the fundamental piece around it. And the only way we can guarantee that is to ensure that from the manufacturing level to the point that that product is getting to the patient, it is being handled right, it is been manufactured in the right way, and the quality parameters are upheld from start to end. And that comes in with the quality management system that companies need to meet. When you look at it in goods storage and distribution practices, with these enforcement that have been coming into place, different companies now, by the virtue that the license is at risk, they are moving towards getting third-party stakeholders, getting people to support them in implementing these systems, or in some ways, employing people. The good thing that I'm looking at in terms of where this is moving is the regulator is also enforcing requirement that people should have the technical expertise in terms of the personnel in the company, a key, another component of the quality management system. So the reason as to why I'm doing this video, and actually it's more of an educative conversation, and it's also a conversation starter for one thing that we need to look at from the industry within the pharma value chain for all of us, professionals, stakeholders, investors. We need to commit to doing the right thing, but you also need to understand why is it that we need to do these things the way we say we should do them. And that is a question we need to ask ourselves. Last week, I had a conversation with one of the distributors who had invited me and actually was willing to have a conversation to have me support them in meeting some of these requirements on good storage and distribution practices, which is a good starting point, because then as a technical service provider, within the industry, we bring our expertise to support companies to meet their requirements. The only thing that comes in differently is we do not come in from a point of just setting out, giving a quote and doing the work the way you want it and having a tick box exercise. That is a different ball game. And my challenge is to us as industry professionals, companies, investors, we need to do things differently. It's not a checkbox mechanism. When the regulator talks about good storage and distribution practices, the question they're keen on understanding is, when you set up your warehouse, what quality measures have you put in place to guarantee that wherever you're sourcing your medicines from, that is the supplier you've contracted, has the right quality products and technologies, and therefore they've met the quality at the manufacturing level, and the product is registered in the country where you're distributing it, and therefore you are guaranteeing at the point of receiving it, or actually procurement, you're getting the right products. That will come in from your supplier management, and that one is part of your quality management system. When you get the product in your warehouse, the distribution mechanism, how do you ensure that transit management of that quality is sustained along the chain? When it is in your warehouse, how are you handling them? How do you receive them? How do you store? How do you process it when you're dispatching it to the customers who are using it? What level of technical training or guidance or advisory do you offer to guarantee that the customer who is buying it from you will handle it appropriately, ensure the integrity is maintained across the distribution to the point that it's being used? And finally, When it is in use, how do you ensure that in case of any complaints that are coming from the customers or any recall that might come or whatever it is, you are monitoring and managing these. These are some of the systems that come into place. And when I look at that ecosystem, the quality management system, the good distribution and storage practices that the regulator is asking for are a fundamental requirement in the industry, and we all should commit to doing the right thing. The only differentiator is we need to stop looking at it as a stopgap measure, a checkbox so that we get done with it, but look at it as an institutionalization process to improve our offerings, to improve our quality of commitment, but also to safeguard the well-being of the customers, the clients. It's a business imperative, but also a quality and a regulatory requirement that we have to comply with. Why is this important? In my conversation, as I told you about last week, my engagements and all that, I got one of the contracts, another one didn't go through. One that didn't go through, one of the key things that was clear is I was to do a checkbox mechanism. Get them the documents, they pass the inspections and everything, and that becomes the end of it. I understand this need to meet the checklist, the regulatory requirement, have the documentation set, which is fantastic. But beyond that, we have to commit to doing it. And doing that documentation and supporting in establishing a system means I need to be able to engage with your contractors, your employees, train them to ensure that these processes are socialized and adopted within the organization to ensure that if I say when you're buying products from a company, you need to first verify that they have the certification of manufacturing license from their own regulator, the country of origin, that should be there. And therefore then I should train your procurement person to verify that documentation, to agree that that is going to be there. If that is not going to be permitted as we're just doing whatever it is that need to happen, then it doesn't make sense contracting as technical service provider to help you set up a system that is not a system really, it's just a checkbox mechanism. And this then actually put our regulatory system and our healthcare ecosystem at risk. These are challenges that we need to address. And for me, when I talk about this, good storage and distribution practices is about me and you, because today we are service providers, tomorrow we are patients. Today we are experts in the industry who are doing whatever it is that we're doing to make ends meet. Tomorrow we are the same relative to the person who is getting to consume the product that we supplied in the market that didn't meet the quality standard that we expected, that actually took a shortcut instead of designing a good storage and distribution practice, a quality management system that is robust enough to protect the public, and took a shortcut. And actually that shortcut can cost a life, can affect livelihoods, and most importantly, puts our entire healthcare system at risk, which is derailing our economic progress and our national progress to what we aspire for. And I think these are challenges we need to contend with, we need to address them, and therefore then we need to ask ourselves, are we doing it right? Doing it right is understanding it's not only a checkbox, but it is a systemic improvement plan that we all are committing to. Regulators are reasonable people. They are willing to understand what your circumstances are and work with you in the business continuity plan. But you have to be willing and committed to making the transformation. It will come with a cost, definitely, but that cost, look at it not as a cost, but as an investment in driving and upholding the quality standards of the organization, gaining a competitive advantage in the market, and therefore delivering exemplary service for the long term. If you love the conversation, engage with us, contact us. If you're working with a company, you're keen on getting to understand how you can design your quality management system better and all that, we're more than glad to have a conversation as African Pharmaceutical Network. Get in touch and let's see how we build systems together. For those of you who are learning and feel somebody would find value in this, share the video with them. Subscribe to the channel. Let's grow and let's build a bigger ecosystem and a better pharmaceutical and life science value chain in Africa. Thank you and have a good one.